You know when you go to the dentist and they start looking around your mouth and they take those stupid pointy instruments and they start poking around just to complain that you don't floss enough? There has to be a reason that they're doing that, right? I mean, they're not just trying to make you mad, right? Right. They're actually just checking the health of your gums. And one thing we're checking for when we do this is if your gums are swollen. Your gums can be swollen for a lot of reasons. And sometimes the gums in your whole mouth are swollen, and sometimes they're just swollen in one specific area. So I'm gonna give you 7 reasons why your gums could be swollen. Number 1 is gum disease. This is probably the most likely reason that you have swollen gums. Gum disease, or gingivitis, means that you have inflammation in your gums. The usual cause of gum disease means you're not keeping your teeth and your gums clean. So this means that a lot of plaque and bacteria are left behind and they're causing damage to your teeth and your gums. Over time, your gums will start to look more red, they'll look more swollen, they'll probably be bleeding a lot more, and they just won't look healthy. So what do you have to do? You have to start brushing twice a day and flossing once a day. It's as simple as that. And you have to make sure you're going to the dentist every 6 months to get your teeth clean. Now, number 2 is periodontal disease. Periodontal disease is basically gum disease, but going one step further. Now, instead of just affecting your gums, you're also affecting the bones that surround your teeth. This means that inflammation from gum disease has gotten worse and it's been left untreated for a long period of time. And at this point, it's irreversible. You can never get the bone that you lose back when you have periodontal disease. So what do you have to do now? Same thing as before. Make sure you're keeping your teeth clean and make sure you're going to the dentist. Only now you're probably gonna wanna go a little more frequently because you're at a higher risk now of losing all your teeth. Number 3 is an aphthous ulcer, also called a canker sore. You probably know what canker sores are because you get them on your lips or your gums from time to time, and they're just super annoying and super painful. Well, there's 2 main causes of canker sores. One is stress, and another reason is trauma or some type of damage to that area. So if you're ever super stressed or if you have a ton of exams going on, and now you notice one of these stupid pesky canker sores form, that's probably why. Or if you're brushing your teeth super hard in one area, or if you just hit one area, that's another reason one of these canker sores can form. Number 4 is pregnancy. When you're pregnant, your hormones are changing a lot, and this can really affect your gums. And it can actually make your gums more vulnerable to getting plaque. And there's actually a term for this. It's not just called regular gingivitis, it's actually called pregnancy gingivitis. Number 5 is if you have an infection. Now, an infection is probably going to be more isolated to one specific area, and it's usually going to mean you have an infection in one of your teeth. So when you have an infection forming in your tooth, it can lead to an abscess or some swelling in your gums in that area. That's a sign that you need to get one of your teeth taken out or you need to get a root canal. But regardless, you should definitely go to your dentist if you see one of these forming just to get it checked. The 6th reason you have swollen gums is from tobacco products. Using tobacco products like a tobacco pouch and putting them against your gums can cause these white lesions to form, and it can cause your gums to swell. Tobacco is very harsh and it can damage your gums and your teeth when you put it against them. And using tobacco products will greatly increase your risk of getting oral cancer. So this makes it very important for you to get checked by your dentist and get an oral cancer screening. The 7th reason you might have swollen gums is if you have a tumor or a tumor-like growth. Tumors or tumor-like growths can happen in your gums for a lot of reasons. Sometimes these growths can be benign, and sometimes they can be in response to some sort of trauma, or they could be not in response to anything. But anyway, it just shows why it's so important to go to the dentist and get an oral cancer screening and just get your gums checked in general, because it's always better to catch something like this early. Thank you guys for watching. I hope you liked that video, and if you haven't already, please hit that thumbs up button and subscribe to my channel below. And I'll see you in the next video.